During the recent throne speech, part of the government's agenda for 2022 was pushing forward with the implementation of the National Health Insurance Scheme. The NHI, according to government, will be critical to sustainable financing for improving healthcare delivery and building resilience within the sector. Two Grenadian citizens who are aligned with the NDC have since added another perspective. Maria Pascal, who has a medical background, says she supports being taxed for healthcare.
As I said already, health, just as education, is non-tangible profit. So even if the government had to add an extra tax on the people just for health, because the people knowing that tax is increased for health care. So you will walk into the hospital, you don't have to worry if you meet in an accident that you have to have a $400 or $500 for the ambulance or for medicine. You know that will be taken care of. It's just as insurance. The taxes, it will be just as insurance, that you put an insurance there and you know if you have any crisis, the money is already paid off.
Economist Lennox Andrews says he also shares such a perspective, even more so from a fiscal standpoint.
Government is a public good, and government is here to provide public goods and services, yeah? And they do so through the collection of taxes. Now, what are these public goods and services? They could be roads, they could be hospitals, they could be schools, right? These are services that the population on a whole don't pay for directly, right? But they have with them what they call, or what the economists refer to as positive externalities. Positive externalities, which means that they bring benefit to the population as a whole, right? Even though individually we do not have to pay for them. And health services are one of those public goods that government must provide.
So the NDC would have no problem in adding taxations upon the heavy load already?
I will certainly advise the NDC in that regard.
I am Gerard Joseph for GBN News.